Well, hi, everybody. For those of you who are with us straight on the top of the hour, we are some folks from Seattle, Washington, hosting a webinar about data collected through our Wraparound Fidelity Assessment System. And we will let folks join for a minute or two. While you are coming online, we would love for you to put your name and where you're from, organization and or geographic location in the chat. It's always fun to see folks we know and then also folks we don't know showing up in there. So feel free to introduce yourself. Oh, Steve was quickest on the draw from New Mexico. Oh, I love this. Hi, Nathan. Oh, there's Kim, right on time. Yeah, so please feel free to introduce yourselves to others. You are all in a community of practice with one another. Hi, Lydia from West Virginia, state in which I got married. Milwaukee is in the house, Idaho, Oregon, New Jersey. Hi, Diane from Kentucky, others from Kentucky. So yeah, let us know who's here and we'll get started in about 1 minute. Excited to share data back with folks, many of whom, just seeing the names flowing through, are responsible for collecting those data on how Wraparound is doing in your state or program and how your youth and families are doing as well. New Hampshire, Wisconsin. So while you're joining, just a few things about housekeeping here. Looks like we're settling into about 85 folks. Again, this is going to be a webinar feeding back data to you all, many of whom are users of our Wraparound Fidelity Assessment System tools. And this is just our kind of continuing effort to feed data back into the community of practice, promote understanding, discussion. And I see British Columbia's in the house, which means we can truly say this is an international event. So hello from BC, just up the road from me here in Seattle. All right, let's get started. So thank you for joining us. Again, I'm Eric Bruns, professor in the School of Medicine here at the University of Washington in gloomy Seattle today. But much more important, I am the director of the National Wraparound Initiative, have been for over 20 years now with Janet Walker and with Kim Estep and others from the University of Connecticut. Get to co-direct the National Wraparound Implementation Center as well. Excuse me. I had COVID last week, so it's catching back up with me here. So we established WORT back in about 1999 when I was at the University of Vermont with John Burchard. We would never have thought that there would be a data system. This is something John dreamed of, a data system that would compile outcomes and quality, satisfaction, fidelity data for literally tens of thousands of young people across the country. John's wife, Sarah, one time after he passed in 2004, she retired shortly thereafter, and she was campaigning for Barack Obama across the country. And she was in Nevada and came just across as she was driving around a sign on a building in Las Vegas that said Wraparound in Nevada Initiative over the door or over the building. And she wrote me and she said, is Wraparound like places other than Vermont? Little did she know that it would become such an incredible thing. And we just are thankful for all of you for being part of it. So here we are today. The WORK team has had many team members over the past 20 years, and the majority of whom have served here at the University of Washington. So here's the majority of our current team, but I want to give particular thanks to our co-presenters who and folks who prepared for today. We have Catherine Soon, who is offline or off camera, working on our Jamboard. We have Olivia Linkus, who's been an incredible asset to the team collecting data in states and is going to share some of the lessons learned. And Jonathan Olson, our research scientist, Dr. Olson, who famously was first author on many different wraparound publications. And there is Nevada in the house. Hi, Amy. So this is the campus of UW. There's some cherry blossoms, and somehow we had some blue sky that day. That was crazy. So thanks to everyone, including Jade Richards, our research manager, Katie Renteria, who does incredible work supporting our WrapStat users, and Kristen Vick, who did our map today and also has been a great new team member. So what we're going to talk about today, we have collected data from a lot of different measures, and the National Wraparound Implementation Center pays more attention perhaps to organizational and system measures of wraparound, because we know that that's where we really need change to happen if we're going to support kids and families with systems of care. But we here at WIRT and with the WrapStat system, we really focus on team level, family level data collection to support that effort as well. And so, because it all boils down to the family's experiences. So the three measures that are incorporated into our data system, as you know, are the Wraparound Fidelity Index, surveys of care coordinators, caregivers, youth, and team members, the team observation measure, and the probably most reliable and objective of our measures, although it doesn't get families' perspectives directly. It's a method of coding out from documentation, the Wraparound Document Assessment and Review tool. And these are our measures that are captured in WrapStat, and we're going to focus today on the survey data from the Wraparound Fidelity Index. Little update, we're talking about a national community of practice. We are down to 4 states now where we have no presence, as far as we can tell, in our collaborator database. And we are up to over 20 states with statewide use of the measures, or who are getting statewide support from the National Wraparound Implementation Center. You can see all of the states that are have or are currently getting support from the National Wraparound Implementation Center here on the map. And it's incredible how hard they work. Those who are indeed getting statewide support or any kind of support from NWI also get access to the Wraparound Fidelity Assessment tools as part of their CQI efforts that we support. So let's talk a little bit about today and get to it. We're down, all the data we're going to be showing today is thanks to our many hundreds of thousands of dollars we've invested in developing and maintaining the WrapStat system. We've been disseminating the fidelity measures, or at least one of them or all of them, for many years, but it's only with the switch to this data system that we've been able to really help facilitate data collection and rigor by local folks and states doing this work. And it's only through WrapStat that we're able to do things like pull all the data we're going to show you today, so that we know, what states and sites might even be relevant to pull into our research studies. The whole idea here is that WrapStat's a system that can help you do your work with greater quality and keep you on track with data collection on fidelity and outcomes for kids in your wraparound. But it gives us a chance to also do research. There's a lot of different models out there that have what they call patient registries. That is a big part of the model. And this is, we don't use the term patient, but this is, and I'm in a school of medicine, so I hear about these patient registries for collaborative care, patient registries for parent-child interaction therapy or whatever. This is about families and youth, and but it serves a similar purpose. But for you all, what we hope it does is promote rigorous data collection by giving you the ability to sample randomly, so you don't have to collect data on all your kids and get high response rates. It lets you evaluate outcomes, which is something we learned a long time ago. People will collect fidelity data, but not outcomes data, which is just not what we want. WrapStat allows you to enter those outcomes, real minimal outcome data set, and manage the data so that you can get reports and dashboards and so forth. But most of all, the reason we can do things like this is because of you all. And we have over 85 sites. So just a little thank you, a little summary prepared by our research manager, Jade. The main thing is not to read all of the names, but you can see we have almost 30 orgs serving under 100 families that use our tools. And then a good handful all the way up to our big state initiatives with thousands of families being served. And this is just an incredible opportunity that we're just beginning to build on to do research. So let's go to it. The idea here is we're going to continue to practice what we preach to Wraparound and other evaluators all across the world, which is if you want people to collect data, you need to feed the data back and make sure that they see what they're contributing to. We want people to use these data to just promote conversations, make meaning, try and make understanding at your local levels, right? We want it to be those conversations to be held at the team level, at the family level, at the organizational level, at the provider level, at the program level, at the state level, and like today, even at the international level. So in the future, we may very well be presenting data, I know we will be, on the DART, on the TOM, on outcomes. We're going to be hosting more and more of these to make sure everyone in our community of practice is on the same page about what we're learning. Okay, so quick poll. Matt, you want to put out there our poll and see what kinds of tools folks who are joining us today are using. So what tools are you using? You can, I think you can select multiple of the tools, but you could also select none of the above if you're here just interested or investigating the options, maybe just getting started. So what of our measures are you using? The Wraparound Fidelity Index, short form, the team observation measure, the DART, 2 of them, 3 of them. Who's here with us today? And we'll let you all do that and keep on moving here. And let's see, yes, you all should know that, yes, the National Wraparound Initiative has got a webinar tab where all of our webinars are kept. So what tools are folks using? The survey says we've got over half of our folks here are using the WFI-EZ. That's what we're going to be talking about now. So that makes total sense. We also have a good number of users at the TOM, and an increasing, a percent we wouldn't have seen just a year ago using the document assessment and review tool. We're really going to be drilling down into the DART this year. 2024 is going to be the year of the DART. It is just proving to be such an extraordinary method of just taking the pulse of your wraparound initiative, fidelity, and outcomes. And for the quarter of you who aren't using any, please feel free to let us know. Could you put our email in the chat, and then you can always email us at the team about any questions you might have. Last thing before we get started, so here are things we're going to talk about. What kind of survey completion rates are we seeing in our community of practice? How well do they represent all wraparound being served? Are we getting representative feedback? What do the data say about fidelity, quality, and satisfaction across our many, many users out there? How do those scores vary by gender, race, and the size of the community? And finally, what can we learn from the open-ended feedback in the WFI-EZ? There's an open-ended response box that folks, I think, don't take enough advantage of, that you should take advantage of, because it can provide some incredibly rich detail. Now, this is the last thing. We're going to show you some data, but we want to get your input. We need you to tell us what you think. So we're going to put a link right now into a Jamboard where you can go in and you click a sticky note and stick it on there with any thought that you have. Put those stickies wherever you want. So you can see there's 3 boards. Thoughts on the data. What do you think these data mean as we go? What more can work do with these data or for you? And then any other thoughts. You can click at the top, scroll between the boards, but it doesn't really matter. Just put your thoughts there, and Catherine is going to kind of organize any of the thoughts that you've got as we do this, and then we'll have a record of what people think might be the reasons for some of the results we're seeing, some of the things we could do better. So I'm going to hand it over to John Olson to talk a little bit about the first thing that we learned, which is what are the survey completion rates for the WFI-EZ? If we're going to say we're going to collect data from families, well, we want it to be of the actual families are being served, not the ones that are easiest to get to. So what are we learning about the degree to which our many collaborators are getting good survey completion rates of their families.
All right, great. Thank you, Eric, and thank you all for joining this morning. We're excited to share some of our lessons that we have learned. We've really been excited to dig into the data. As Eric said at the beginning, having WrapStat up and going and having thousands and thousands of youth and families who are enrolled in Wraparound, and having a place to gather these data, and as Eric said, to help feed data back to you, but also for us to answer some of these questions. So when we started, the logical first place to start was to look at quality of data. Now we're talking today, as Eric suggested, just on the WFI-EZ, but some of these lessons have implications, and I'll talk about that a little bit later on for some of our other measures as well. But by survey completion rates, this would mean those youth that are drawn to be part of a sample, how many, and when we're talking just about the WFI-EZ, how many do we actually get surveys for? How many of the families, the caregivers who we're focusing on today, the caregiver WFI-EZ, are completing and submitting a survey? And why is this important? You know, I think most of us understand that if we're, as Eric already suggested, if we want to learn about how Wraparound is going in our local communities, we need to have a representative sample. As Eric said, not just the convenient samples, the easy samples to gather, but really figuring out what is going on overall. And what we see with survey-based research in particular is oftentimes those that participate in surveys feel strongly, either very positively or potentially very negatively. So we miss that kind of that big middle of individuals. So how are we doing? Eric can go to the next slide, and you'll see that overall, at the state level, we've got some room for improvement in terms of completion rates. I put here that the target completion rate of 60%. I'll be completely honest, that's a pretty low bar. It's been hard to get survey responses, especially as we're inundated with so much information and we've moved to electronic surveys. We've seen a drop-off in survey response rates across the board. This isn't just in Wraparound, it's not just the WFI-EZ. So it takes a lot of effort. In fact, we did a webinar a while back on how to get those response rates up. Back in the day when I was in graduate school, we would say we'd shoot for at least 75% or 80%. That is very difficult to get these days. So we put our bar at 60%. As you can see at the state level, only a handful of states, really only 2 of the 13 we have listed here are achieving that or more. Now, if we go to the next slide, we'll see at the organization level, we get a slightly different picture, right? Because within each state, there are a variety of organizations, some of whom are getting really good response rates and some of whom are struggling. But you see here, we do get 11% that are at that 80% or higher, and another 11% at 60% or higher. But that leaves a significant portion where we really do need to work to get response rates up a little bit further. Next couple of slides I'll show you. If you can flip to the next one, Eric. Yes, perfect. Yeah, you can go to the next one, actually. These data are not perfect, okay? But it's our first stab at looking at WFI-EZ response rates against all the data that we have in WrapStat, okay? And there's some issues we're working out right now on coding and whatnot, but as you can see, we actually do a relatively good job looking at, in this case, our race and our ethnicity data. Race, as you can see, we have in the WFI-EZ data, we have a lower percentage of those that identify as white or Caucasian, and a higher percentage that identify as other. We're currently looking to see, is that a data coding issue, or is it a response, a representation issue in the data? We'll be continuing to look at that. But it does raise a little bit of a concern that the numbers are a little bit different. On ethnicity, we're pretty spot on. Despite having relatively low response rates, we are getting about the same numbers in terms of, or percentages represented in terms of those that identify as Hispanic or Latino or Latina. And on the next slide, you'll see the same for gender. Again, we're looking pretty good in terms of the numbers lining up. But at age, we're getting more youth, a higher percentage of youth in our WFI samples in that 13 to 16 range, and fewer at the 9 to 12 range. So the main take-home message here is that we currently have samples that are reasonably representative on these particular indicators. We want to continue to look at other indicators of demographics and characteristics of families to see how we're doing here. But we definitely have work to do. So I would say for the rest of the slides we'll show today, we do have reasonable confidence in these data, but we'd like to do even better in terms of getting those representative samples.
And I would love to know from all of you who are doing this work out there, why is it that we would be oversampling or that there would be more data from families, because this is caregiver data of the youth who are older? Is that because folks are prioritizing getting caregiver and youth data for older youth who would be able to complete the youth form? I guess I'm not 100% sure. If you have any ideas about that, put it on the Jamboard, put it in the chat. Yeah, we all want to learn together here.
And with that, I believe I'm handing it back off to Eric to dig into some of the satisfaction data and the fidelity data that we've gathered from the WFI-EZ. And I'll be back on in a few more minutes.
Right. So like John was just saying, one of the things that's critical for us to make the most of the data that we collect is that that we're getting representative responses from representative youth and caregivers in particular, who are actually receiving care through the wraparound process in your communities and states. But so in the future, what we're going to be doing is really looking at the relationship between what John just presented, which is response rates, and what I'm now going to present, which is, well, what kind of responses are we getting about how well wraparound is working for families? We have some pretty good preliminary data that at the state level, the states that are getting lower response rates are also getting higher scores on satisfaction and fidelity, which makes us really think about how important it might be to screen out the states and sites that are getting low response rates, if that also means that their families who are being included are more likely to be satisfied. So anyways, just a little bridge there and a plug to make sure that you're keeping an eye on that part of your dashboard in WrapStat about your response rates and doing whatever you can to get them as high as possible. But without doing any of that filtering out that we probably will be doing in the future of states and sites with low response rates, looking at all of the data that we have, I believe, John can correct me if I'm wrong there, but we start by looking at those basic items in the Wraparound Fidelity Index that just ask the most fundamental things. Do you have a team? Do you have a plan? And does the team meet regularly? And of course, a little bit more subjective, our wraparound team's decisions are based on input from me and my family. What we're seeing across the country and Canada, New Zealand, and other places is that generally we do have the right kinds of organizations even using our fidelity tool, that the parents are saying and caregivers are saying that these basic elements of wraparound are happening. But again, this will be the kind of thing that now that we've got a little bit of an insight into this, not just for all of you, but for individual sites and states, we'll know whether or not there might need to be some screening out of certain initiatives that maybe are not at what we would expect, 97, 98%. We do see some sites and states usually who are saying, yeah, we know we're not totally doing wraparound, but we wanted to use this anyway as a way of getting a baseline. That's all great. But if you're, a good number of your families don't even have a team or a written plan, we'll probably be screening them out of some of our research. But, the implementation of the core components, like I was just saying, varies by state. Some of these states are upwards of 100%, and some are down in the 80s. And so just using these kinds of things to start the conversations, what, are you actually doing with almost unwavering consistency, the kinds of things that a wraparound initiative really must be promoting? Having a team that meets regularly, having a written plan of care, basing decisions on the family. This is a starting point for us to look at the data, for you to look at the data, and so forth. So we're getting started on looking at this by state and by provider organization. Looking at overall scores, again, across over 5,000 fidelity tools from caregivers, we see pretty good room for improvement in terms of both fidelity to the core elements of wraparound, the key elements, and also the satisfaction of our caregivers and parents. So you can see here, for those of you who aren't familiar with the tool, although I don't think there's a lot of you out there, an example fidelity item that goes into this score of 71% of total possible. One of the 25 items is my family was linked to community resources I found valuable. Families essentially respond to that, caregivers and youth, on a 0 to 4 scale. And the satisfaction item, I'm satisfied with my youth's progress. There's only 4 of these items. I'm satisfied with wraparound, I'm satisfied with my youth's progress, etc. 78% of total possible. So on average, that makes it, about a little over a 3 on average out of a 0 to 4 scale. But we have to say that this is not something to necessarily celebrate, because John and others before him have done analyses, and it consistently shows that the sites and states that are capable of doing 2 things: having discharged from wraparound care coordination for positive reasons, because they've made progress, they're ready to step down from that kind of intensive support, and another outcome, which is keeping the young person at home, in school, and out of trouble. Those rigorous studies that found sites that have been able to really achieve those outcomes better than average, they also have wraparound fidelity scores that are at least 75 out of the 100-point scale that we use. So we've created this set of benchmarks that basically helps us know that on average across the country, an average score on the Wraparound Fidelity Index of 70.8 is really barely borderline fidelity when it comes to what we see as associated with positive outcomes. Okay, so we can look at this another way. Again, we've got 13 states with 50, 100, 200, 1,000 different kids in there. Most of these states have hundreds, if not thousands. So it's pretty robust sample sizes. And we looked at the average scores, and we see this variation, right? You say, well, 64 to 79 is basically our range by states. It's only 14 points. But I'll tell you, measurement's a funny thing. Those 14 points, that's a span of about 4 standard deviations. That's a huge difference between the low scoring states and the high scoring. And from our research, we know that those scores, the low end, the 70s, the 68s, the 69s, those are really not associated with positive outcomes. And what we're really looking for is to be pushing that 80% mark with good representative sampling. And so most of our states are in that borderline range. What we're going to be doing in future webinars is bringing our National Wraparound Implementation Center folks in with us and talk about what the individual items are that are making up some of these high performing versus lower performing sites and states. And what are some things that those scores on those individual items or scales mean, so that we can start putting out some information about, well, what would you likely be focusing on at a system or a program to improve those scores? But what we're seeing right now, because this is our first peek at these data, 2 years into WrapStat, we're beginning to see the patterns, and it's going to hopefully be really useful at conducting research and feeding back some ideas. I gotta move my little thing here. Only 46% of WFI-EZ user sites achieved adequate or high overall fidelity. So you can see this really even distribution, a quarter high over a quarter inadequate. That's where we're going to be looking. What kind of outcomes are we getting if we get high fidelity? What kinds of things can we do to improve those sites and states that are down there in the inadequate range? What are the things that are challenging them? What are the things that we can do better? We know what some of those things are from other studies we've presented, that when you have a system that invests in truly flexible funds, a state center of excellence that can really help with staff skills, making sure you have a strong service array of evidence-based practices, youth and parent peer support, you're truly being family driven and not just grabbing the clinician to come into every family's house from day one, but you're asking what the family needs before you start plugging stuff into their plan. Those are the kinds of things that are getting folks to high fidelity. It's all at the system. Remember Bill Clinton, it's the economy, stupid. Well, in wraparound, it's the system, stupid. How is the system set up? Is it actually rigid, or is it truly promoting of high fidelity? So we're going to be digging into that this year as well in future webinars. It's really good to have this picture, though. And then in terms of satisfaction, benchmarks also help us interpret caregiver satisfaction scores. You could say, wow, 78% satisfaction. Research and evaluation in human services says that, it's pretty much the norm to get 85 or 90% satisfaction. We look at the data and say, you want to be getting at least 88%, 93%. But again, when you ask parents how satisfied they are with what they've gotten, with their child's progress, again, we see in a way, this pattern might look pretty familiar. Low fidelity, low satisfaction. High fidelity, high satisfaction. But most states are falling in the borderline range again. So everyone should be looking at their data, showing it to their parents, showing it to themselves, and asking, what can we do here? Let's use this as a baseline and ask what we need to be doing differently with our staff, with our systems, with our funding. Because again, more than half of all the caregivers are reporting levels of satisfaction that really are in the borderline or inadequate levels. But what about these folks? What are they doing that's different than these folks? That's what we're going to be doing with these data now that we have them. If you have ideas about what you've done in your own initiative or state that might have moved the needle on outcomes and fidelity and satisfaction on these kinds of items, please put them in the Jamboard. We want to take a look and see what you think. So, I think I already made this point. If the average satisfaction is 79%, why are most borderline or inadequate? That doesn't make any sense. It seems like it's pretty good. But again, as John has noted already, there's a positive response bias in people who receive services reports. They don't want to rat out someone who's trying to do their job, and for whom probably the things that are holding them back are how much they're paid, how many services they have available to plug in for the family, how long they've been able to work, how well they've been trained, things that have nothing to do with them. But we know that folks will generally say that they're pretty satisfied with the person who's helping them. So our benchmarks help to interpret the satisfaction score. So look at those carefully. They're available on our website. Maybe Catherine, you can put a link to the benchmarks where they reside on the WRT website for us. I think this is where I hand it back to John.
Thanks, Eric. So the next piece that we dug into, which I think is exciting. I think it's all exciting, but is looking at some of the ways in which our WFI-EZ scores vary specifically by the characteristics of the youth and families who are enrolled. I'm just going to give you a few slides, a little teaser on some of the larger demographic characteristics. Yeah, thank you, Eric. So we began with gender, and what we see here is just a comparison. How do WFI-EZ fidelity scores, just the total score, how does it vary across the different categories by which people might identify? And what we saw here is across male and female, those that identify as male or female, we don't see, it's rounding error, 70.6 versus 70.7, with a little bit of a drop off for those that identify as non-binary or other gender identity. So that's something we want to track, right? As you can see, the sample size is very, very small compared to the thousands that we have that identify as female or male. We're only 65 that identify as non-binary or a different gender identity. But it's something we want to keep an eye on, right? So we don't want to dismiss and say, well, it's a small sample. It could be sampling error alone when you get to such a small sample size, but something we want to track over time, especially since on the next slide, we see the very same relationship with satisfaction. Again, rounding error for those that identify as female or male, and then a drop off for those that identify as non-binary or a different gender category that wasn't captured on the survey.
So Phil, we got a great question. You know, we did learn that 25% of folks don't use any of our tools. They're probably here because they're interested in the topic. So for those of you who aren't familiar, I'm going to go back one slide here. So for example, when we see that the Wraparound Fidelity Index short form fidelity score by gender is 70% to 67%, what that means is there's 25 items in the Wraparound Fidelity Index that speak to different things that we want to happen in the wraparound care coordination process. And families are able to answer that this didn't happen at all the way up to, yes, this happened to the fullest extent. And again, there are examples of things like I was connected to resources I found helpful. My team members understood my needs, things like that that are really part of what we want to happen in care coordination. And so we take those 25 items, they're on a 0 to 4 scale. And so 25 times 4, you would have a perfect 100% if all your respondents gave 4s to all 25 items, but that doesn't hardly ever happen. So if it was on average 3 out of 4 for all those 25 items, you would have a total fidelity score of 75%. I hope that helps a little bit. Catherine has put a link to where the tools are described in detail.
Yeah, great. And I also should note, for those of you that are if you're obsessive about numbers like I am, and see that some of these numbers like, oh wait, these look a little lower than what Eric just presented, keep in mind that not everybody is collecting gender or the demographics with the EZ. So you'll see the scores are going to vary a little bit, and you'll see the sample sizes vary a little bit based on the data we have available. Okay, so this next slide is an interesting one as well. We look at race and ethnicity. And for these scores, we used we used white as a reference group. So we're comparing those that identify as BIPOC, and you can see we have on this slide different categories: Black, African American, Native American, Hispanic, and so on. And it's an interesting trend that we're seeing, that we see higher fidelity scores in some of those youth who are identifying as BIPOC. Again, with some exceptions, of course, we look at multiracial and Asian. And just like with gender, we'd want to keep tracking those that identify as Asian because it is a very small sample that we have currently. So we'll want to keep tracking. But we see this trend both in this slide where we see, and as Eric has pointed out before, sometimes these small differences, it's less than a 2-point difference, but can have big effects in terms of what it means for the experiences youth have and the outcomes that they experience coming out of wraparound. But you see this trend here on the fidelity scores, and Eric, if we go to the next slide, we see a very similar trend with the satisfaction scores as well. Again, a couple of point difference here between certain racial ethnic identities and others. So, and what's noteworthy here is this isn't just happening in isolation. If you go to the next slide, as Eric mentioned at the beginning of this, when he was introducing me, we had a meta-analysis. I want to give credit to a whole host of folks who worked on this meta-analysis. It was a huge team project. So while Eric gave me kudos for this, and I appreciate that, it really was a large team effort. But what these data show, and I'm bringing this in just to put in some context in terms of interpreting what we're seeing on the WFI-EZ data, we saw even a much stronger trend in our meta-analysis, which for those that are not familiar, a meta-analysis is an analysis of analyses, right? Where we're running statistics based on a large sample of other studies that have been conducted on wraparound outcomes. And for this particular slide, it includes 16 high-quality controlled studies. And we saw very large differences in effect sizes for those that focused more on BIPOC youth versus those that focused almost exclusively on those that identify as white. And that was across multiple outcomes: mental health symptoms, functioning. Juvenile justice was smaller, but school functioning, residential, and then we combine and look at a combined outcome for those that participated in wraparound. We also saw that big difference. So it suggests that the WFI-EZ data that we're seeing are following a trend, and it's something that we definitely want to follow up on as a field. Our group has plans Catherine and Olivia and others on our team have an interest in pursuing more in-depth analyses to really try to tease out what is going on here, what core components of wraparound are associated with some of these differences that we see by race and ethnicity. And one other point I will make, I don't have a slide on this because the data are very preliminary, but as Eric said, we're starting to roll out more and more. He said it's kind of the year of the dart. Our first initial analyses are showing some of these similar trends. Not quite as straightforward, but we are seeing some trends where those that identify as BIPOC in the dart also are showing slightly higher fidelity scores. So it seems to be something we're seeing consistently, while the effect sizes in some cases on the WFI-EZ and the dart seem small, the effect sizes in the meta-analysis were moderate size to even large on mental health symptoms. Okay. With that, let's move to the next slide. We also looked at population size. And what we saw here is that for those youth and caregivers who live in smaller communities tend to have higher scores than those in larger communities. And this is on wraparound fidelity scores. On the next slide, you'll see a similar trend for those satisfaction scores as well. We tried to run, I'm not going to go into a lot of detail today because it's still a work in progress. We were taking a look at whether or not some of these community size and demographic features of a full community can help explain some of the racial differences, the race and ethnicity, ethnic differences that we're seeing. And that didn't quite play out yet. So kind of, we're not seeing an emerging trend there. We'll continue to look a little bit more. But at the very least, at this point, we're seeing that there at least are some differences in youth served within larger communities or smaller communities. All right, and then with that, I am going to hand it over to Olivia, who's done a magnificent job looking through, sorting, coding, and drawing conclusions based on some of our qualitative, our open-ended response categories or questions on the WFI-EZ. So I'll step out and hand it over to Olivia.
Thanks, John. Yeah, so we've talked a lot about the quantitative data that you can get through it, and I think, it's exciting to have qualitative to really complement all those quantitative responses to get a better idea of what's going on and why you might have those lower scores. And certain across like satisfaction and fidelity, like we've talked about. If you'll go to the next slide, Eric. So only a few organizations are using open-ended WFI-EZ questions to collect qualitative feedback. I know some people are not using the WFI-EZ, so just as kind of like an overview, there is a section that you get 2 questions, and the purposes of the data I'm about to show you, it comes from a statewide initiative in which caregivers and care coordinators complete those WFI-EZs and provide that qualitative feedback. And so that comes from 70 caregivers and 151 care coordinators. And then if you want to, and that provides more detail to those quantitative ones, but we've used it in different ways to provide extra context of what's going on.
And and this is just from one state, right? It's because some states are doing this consistently and others not so much, but we think it's a real important thing to do.
So to start, 2 people on our team will look at all these questions open-ended, and they will code it for themes. The first one being positive, negative, or neutral, and the second being kind of more specific themes. So to start, those first ones, the positive and negative, we saw that more than half of caregivers reported positive experiences with wraparound, with that being 39 being positive, 22 being negative, and then 9 being neutral. And then after that, we go into more detail and find out exactly what's going on. So for instance, when you look at the positives, will be helpful team members, amazing care coordinator, provide additional support, and great program. Whereas some negative themes that came up were unmet needs, poor coordination or communication, and systematic barriers. And then kind of more neutral, just anytime someone brought up mental health services, that was kind of a neutral theme that we coded as well. And to get kind of a better idea of this, we pulled some direct quotes from caregivers so you can see how it's been like thematically coded. So for instance, helpful team members, the agency was wonderful, caregiver could not get help anywhere until connecting with the wraparound provider organization, and they provided services including medication. It was a light at the end of the tunnel, and the caregiver had to hospitalize use from treatment prior to wraparound involvement. So that's pretty positive, and that's how we got that theme of helpful team members. And then we lead to amazing care coordinator. Our wraparound representative is amazing. He's been a godsend to our family. We still struggle, but care coordinator texts me at least once a week, and I, as the parent, know we can count on him for excellent advice on our process. And then the third top one being unmet needs. Process was slow and ridiculous. It did not meet the needs of my family and failed my daughter. Felt too little, too late. So these were the top three that we had from that. And then when we go to the second question, oh, sorry. One more theme is poor coordination and communication. Our care coordinator has been inconsistent and has no called and does not call us back. And then when we go to the second question, so the second one is more about satisfaction, and we see a change that goes to now having more negative feedback to a question when it asked about their satisfaction with wraparound, that being 25 being positive and 32 being negative and 9 neutral. And then we lead into those more kind of tone in themes. Eric is, oh, there we go. Cool. And so that being success improvement, a good program, or strong teamwork, those are the positive ones we saw, whereas the negative ones were lack of coordination, follow through, poor timeliness, poor communication, and unmet needs. And then that neutral one is just like just brought up some challenges they had just in general, what was going on, to provide that extra context as mentioned. And then kind of highlighting those top ones again with some direct quotes that we pulled. We have success and improvement. Youth has improved from several incidents a week, sometimes per day, to 2 to 3 incidents per month. And I'm happy has not been hospitalized since wraparound began. The next one being good program. I'm satisfied with wraparound. Don't know what I would have done without this program. Everyone's very professional and really gets to know the child well and helps the family through a crisis. And then lack of coordination or follow through. In general, I would give wraparound a 3 out of 10 for my youth trace. We were told them numerous times that he was not getting what he needed and nothing ever really changed much. They talked about doing something tangible for 2 to 3 months and it never happened. Nothing ever happened. He came to us a year ago and left with the same issues. It got to the point where we dreaded the meetings. Now, the unique thing about this project is that we were able to get feedback also from care coordinators. So we got caregiver perspective in those previous 2 slides, and this one is going to go into the care coordinators, and these care coordinators were the ones that were serving the caregivers at the time. So they are matched groups from that same time period. So question 1 is asking about if there were any comments on their families' experiences and when they worked with the families, and care coordinators, kind of the top ones, that themes that came up from their quotes were low engagement, lacking support, family challenges, family follow through, new placement, meeting absences, DCS involvement, and continuous progress. And then to provide some example of those, we have direct quotes as well. The low engagement for this family, they have not done anything advised. Grandmother, guardian has stopped communicating and the youth does not want to move forward to build skills and independent living, and education were two of his greatest concerns. Next one being lacking support. This family's has very unstable supports and youth is at risk for removal. Mother understands the process and wraparound, but due to her low IQ, only manages to use strategies when pointed out. And then the last one, coming from family challenges. This family has been open for a few months now, but due to delays with the family, etc., it has been slow to get going fully. Therefore, it's made it somewhat difficult to answer some of the questions asked.
So, Olivia, just interjecting real quick. We talked about this at the National Wraparound Implementation Center, that we have these incredibly rich quotes from caregivers and care coordinators. We'd just love you to kind of ruminate on some of these comments and just say, what do you think of these?
Yeah, I think when we look at it as a team for that statewide wraparound initiative, we saw a real need to talk about some of the language used. We used it for training and whatnot, as well as, some of the things when you see talking about how there's no supports and they're fickle and whatnot, there's also certain agencies have gone and built up resource inventory. So there's really a lot of opportunities to get that context of knowing how we can improve the quality of care that these organizations are providing. And that's why it's really important to collect this data, as well as like even that one that you see for lacking supports, like that direct quote has been used in training to kind of teach the next generation of care coordinators to know this is not really strength-based language, and that language matters, which could seem something so small, but changing that perspective really improves the quality of the services you're providing. And then for the next second question, talking about any additional comments, we had the same of those coded themes as well. The first one being school difficulty. That one's kind of like academic challenges and suspensions. And then we have youth and family progress, youth peer socialization, so how they're getting along with their peers, and then team collaboration, legal involvement, behavioral health challenges, behavior improvement, as well as youth and family engagement. And then the most common themes that came from that on the youth outcomes were focused mainly on school, overall progress, and team processes. Specific quotes being for school difficulty, many school suspensions, youth was had to move to a new school due to inappropriate touch. Youth and family progress, the youth had a light bulb moment of her behavior towards mom and realized that how she was acting is not normal or warranted. She reached out and hugged her mom for the rest of the child and family team meeting and stated, "I'm sorry, and I get it now." And then the final one being team collaboration. Team is navigating the process of wraparound and who will be supportive of the process. And the youth has undergone IEP testing in the school and measures in place that will have more success in that setting. And so the key takeaway of this is that wraparound provider organizations can do this with their own data. They can get their own qualitative feedback and identify the specific needs and barriers of the families that they're serving, as well as it can give insight to those low scoring domain and items for the qualitative from WFI-EZ scales. And then, as mentioned before, this is great to get care coordinator feedback to find out where training is needed or coaching, as well as certain barriers that they might be experiencing, such as turnover and whatnot. And it's really good to use that to highlight that, as well as comments also help coaches and supervisors identify point out areas of needed skills, such as solution focused, strength based, and family driven. That comes back to that comment about caregivers IQ, finding ways to hone in on what training needs to be identified to kind of help hone the skills of care coordinators. So yeah.
Amazing job as always, Olivia.
Thank you.
So I'm gonna ask, I have no idea what might be going on in the Jamboard. Catherine, would you like to, is it worth showing? Got some things going on over there on the Jamboard?
Got a few things going on. Let me share screen.
Okay, let's see what we got. It's always, it's like throwing a party and not knowing who's going to show up. Looks like we got some thoughts on the data and what they might mean. And some questions. So yeah, really interesting stuff here.
Yeah, most are here. We have a couple for work. Lastly, check nothing here. So we might want to start over on thoughts on the data.
Yeah, why do we think the population of youth who are non-binary or transgender is higher depending on whether they are out or their caregiver supports their gender? It's a really interesting question, and I think this is why we want to kind of just throw some of these results out there, is to kind of say, well, yeah, what might we do next in analyzing these? Maybe plant the seed for you all in your local evaluations to look at data like these and ask those questions yourselves. I think that might be the kind of thing we could ask. How does the rate of non-binary or transgender youth in the WrapStat might vary by different locales and states? Very low number. It'll be interesting to see how it trends over time as well. Love the incorporation of qualitative data. Nice pink sticky note for Valentine's week. Which open-ended questions is this data coming from? Libby, you want to talk a little bit about where that's coming from and where they came from in this example?
Yeah, so this comes from the WFI-EZ, which we've talked about, which I know some people haven't used that on here, and that's why Catherine kind of dropped that link in there to kind of explain more about our tools. But that's kind of one of our self-reported tools. And so when caregivers are filling it out, they're asked two questions, one about their experiences in wraparound, and the second one being about their satisfaction in wraparound. And then there's another version for care coordinators in which they're asked about experiences in wraparound, as well as anything that's happened to the youth when in regards to youth outcomes. So those are where those two questions are from. If you want more information on there, Catherine dropped in the chat, but you can also email to us at rapeval@uw.edu, and one of us would be happy to explain it more if that's helpful.
Yeah, let's drop our email in there one more time so anyone who's got a thought they want to follow up directly with us can just click it and get going with that. So 60% response rate is a low bar, but in my opinion, it's a rather high bar. It is so true. John,
Yeah.
any thoughts?
Let me jump in on that because I feel bad. I don't want to be misinterpreted by saying 60%. When I say low bar, I don't mean an easy bar. That is an incredibly hard and difficult task to get 60%, especially in this day and age of doing survey research. So I'm not suggesting that any of you that are struggling to meet 60% are in any way failing, because it is very, very hard to get high response rates these days. Some ideas that we have. We did a webinar, it was probably a couple of years ago now, I think, on WFI-EZ response rates. But if you go to the NWI website under their archive webinars, you'll see that our team put together a piece back then that looked at some techniques and strategies that you can use. The basic things are, using multiple strategies to try to make sure that you get those response rates up, constant reminders, phone calls, emails, social media, text, whatever you can do to keep on that. If you can do incentives, and that depends if you have in your budget or not, that can all, just a small gift card or small incentive can get response rates up. But really the follow-up, using different formats. You give the option of paper and pencil, online, doing a text-based form and whatnot. And I should actually pause for a moment and ask Olivia if you have any other strategies, because you've been successful working with the state on getting those response rates up as high as possible, and can certainly speak to the challenges and difficulty of doing that as well. That we definitely are aware of that. But let me pause for a minute and see if you have anything other than what I've already talked about.
Yeah, I'll just piggyback on that, John. Yeah, just having for caregivers, but even care coordinators, that getting that response rate up if you're using care coordinators, sometimes involving kind of their supervisors and keeping track of that. We found sometimes that it might fall off for care coordinators, so kind of working as a team to make sure that doesn't fall as well, because it's really nice to have both of those there if you're doing both. But for caregivers, doing multiple modes of doing it is important because you have to be flexible. Caregivers are busy, so doing it by mail, doing it by text, even just like if you get on a phone call and someone's like, oh, I don't have time for this, that's okay. I can text you really quick, or I can email it to you. So just kind of meeting people halfway, because it's really great data to get, and just trying to remain flexible and doing what works for the families you're serving, and like what works for your orgs. That's why I bring back for the care coordinator, like supervisors and whatnot, because me kind of being kind of separate, like having to make sure that you're kind of matching the culture of like that org that you're working with and whatnot, and making sure those people too, because it might be easier coming email from their supervisor than from someone who's totally separate.
Yeah, and that there was a little bit of a couple other things related to this. So someone said something to the effect of how many facilitators or care coordinators know that their families are being surveyed. That can be a route to getting input if the family, as WrapStat allows, doesn't respond to the email or the text. The care coordinator can take a paper form right to the meeting. And someone says, well, what's a adequate sample size? All of this is facilitated by WrapStat being able to allow you to do a random sample, and you can set the number at a level that's doable, right? So you could set that number as if you have 100 families in your wraparound initiative and you decide that you're going to survey folks who've been enrolled between 3 and 9 months, right? And there's 50 of those. Well, set your parameter for we're going to get 40% or 15, whichever is lowest, right? You got 15 families to go get data from. So acceptable sample sizes, really, we find that it's as important to get a representative sample as a large sample. But yeah, there is a kind of a floor of the number that's really going to be meaningful. Probably, 8 or 10. If it's a representative sample, get 8 or 10 in each org or in your little initiative. And as long as it's representative of your overall population, it's probably going to give you something that you can use. So a little bit on that. Any data on what the fidelity components of providers are struggling with most? So we will be coming back with more on that in a future webinar to try and really dig in on the question of what are we seeing as the biggest struggles and things that the National Wraparound Implementation Center has seen and we've seen as researchers as contributing. I mean, some of those things are, the biggest ones are lack of natural supports on teams and meaningfully contributing to the plan of care and the strategies. I mean, that's just been so challenging for so many different initiatives, but it's not been completely incapable of being done. There are places that are able to do that. And largely what we're seeing when in those initiatives and those programs and states that are able to get relatively higher than average scores on those fidelity items, whether it's in the DART or the WFI-EZ or the TOM, is that, they have staff who have gotten really skilled at this, who have low enough caseloads to be able to dedicate the time, who really are skilled at engaging and opening their ears and emptying their minds and listening to their families talk about who they've gotten support from in the past, walking the walk of bringing them into those natural supports into the picture. It really all comes down to the support that the staff get to help families really think about how that might happen. But bottom line is, you're right. It's like 10%, I think, was one take we did from the data across the country that had meaningfully incorporated natural supports into their teams and plans. We have so much that we can do on that. So what we're going to do is in a future webinar, we're going to be looking at some of those patterns down at finer grain and talk a little bit about where we see organizational and system fixes, as well as training and coaching fixes for those kinds of issues. But yeah, that's a big one. Tracking outcomes and fidelity and satisfaction, but progress towards needs, and really using that as a way of keeping individual teams and families on track happens a little bit more commonly, 40 to 50%. But we know that's one of the biggest things that contributes to success in human services is setting clear goals or identifying clear needs and then following through on whether they're getting met. That is, a recipe for success that doesn't happen enough, even though it's a big key element of the wraparound process. Oh, now all of the quotes or all the questions are coming in. Nope, mostly from Catherine. Let's see. Any way for participants to access the recording? Yes, it's going to be on the NWI website, and you can go find lots of other webinars that we've had. Let's see. I think we nailed most of these. What's on anything on the next? Oh, why do we use a 1 to 4 scale? It's actually 0 to 4, I think. Yes. And why do we do that? I don't know. It's a convention in survey research, and wanted to have enough points to give people an opportunity to really think about their experience. Gives a little bit more variability to the data. Any thoughts on that, John?
Yeah, I'd say, yeah, sometimes it's arbitrary. You want enough data points to have, as Eric suggests, a range of scores. There's always the decision to make. As Eric said, it's a 0 to 4. And technically it's actually a -2 to 2 that we recode as a 0 to 4 when we score it. So if you see that on there, and we were kind and gave the middle score so people can sit on the fence. Sometimes you want to do an even number of items so that people are forced to either be somewhere on the agree or the disagree. So we allow that neutral point in this. There's pros and cons to each, but the main idea is that it gives us a range where people who are like, yeah, I don't fully agree, but I kind of agree. So or wow, I'm really truly neutral and on the fence on if this is happening or not, or might experience it, how it might be. So that's where we are.
Anything on the next page, Catherine? Yes. Guidance on improving areas in need of improvement as identified. Yes. So we're really going to kind of dig in on that in a webinar later this year. And so we kind of got a mix of two kinds, thanks to the 84% of you. It's easy to say the percent because we had 100 participants, I think, who are still with us a little over time now. We're here. We can hang out all day, but probably won't do that. So looks like the comments are a little bit about method and then a little bit about what do you do with the data. So we're going to be hitting both of those in the future. We're going to be doing on April 16th, pencil it in probably around the same time of day. We're going to be bringing a panel of folks who are leading statewide or large scale wraparound evaluation efforts that use our measures to talk about how they define their sample sizes, their unit of examination. Are they looking at organizations, providers? How do they staff up to get this done? What's their cadence of collecting data? So April 16th, we'll be talking more about the practicalities of this. And then during the course of the year, we're also going to be digging in further on the data and what folks who might see certain kinds of patterns of strengths and needs. What have been some ways in which states, sometimes with the help of NWIC, sometimes not, have overcome some of those challenges at the team level or the family level? Another thing we're going to do this year is because it's becoming more and more common and desirable, is we're going to do a session with our National Wraparound Implementation Center at the University of Connecticut School of Social Work on tiered care coordination. And what's the idea behind it? How do you practically do that so that you can have care coordination that can be very intensive for those families who need that kind of intensive full wraparound process, and perhaps less intensive, such as through our focus model, all the way down to perhaps a lowest level of care coordination that might be telephonic and with much higher caseloads. So how do we do tiered care coordination? Will be another kind of practical how to do provide the help effectively and those are all planned for this year. All right, provide more videos to use for training observers on the TOM. Yeah, they're getting a little old, huh? Seeing how many folks are still using the TOM really does motivate us to do that. So we're gonna we've got more videos that we can the problem, of course, is just time and resource. We need to code out what we think the gold standard is, explain each one of the items. We can do that. Doing the same thing with our practice documentation stacks for the DART tool. So yes, we want to, just hearing somebody say that helps us know one of the things we need to do. So thank you for that. And any data on national average for the overall WFI score, John, what's up with that? Do we have any such data? I think we just showed it.
Unmute. Yeah, the what was it, 70.8 or whatever that was at the beginning would be the national average for what we have, at least, based on the samples that we have.
Yeah, 70.8, barely borderline, but we think it's more important to look at the benchmarks that I believe Catherine put into the chat. So might do that one more time, Catherine. So yeah, we've got a lot of thoughts for trying to keep this conversation going in the future. If you have ideas about ways we can engage folks who are old timers with our tools, newbies, please send us a note, let us know, throw it on the Jamboard. It's still there, it'll be there forever. I went and found one from a few years ago and I was like, oh wow, those were good ideas. We should do those things. So yeah, feel free to send us feedback to our email address, open up the Jamboard, and our next webinar, April 16th, I think that's right. And but we'll be sending lots of notes about that. Okay. John or Olivia, anything else?
I don't think so. No, just as always, thank you for, it's always really exciting to be part of a presentation team when there are so many folks out there that are interested in the work. So really appreciate y'all following what we're doing and letting us share with you and help support you as we can.
Yeah, thank you all so much for coming today. And if you have any other ideas or questions, just email us and we will get back to you. Oh, there's a little hand clap. Thank you for that. Whoever sent that, I guess that's Matt. He is someone we should also thank. Thank you, Matthew Stern, for helping us with our tech today. And with that, we will say have a great rest of your day and happy Valentine's Day.